have a foreign speaker as well. Severin is kind enough to join us today, and I would ask all my speakers that we should talk in English so that she can also understand the whole conversation. So, Severin, can you hear me, right? And Madam Alia, Madam
तो
Alia,
Yes,
बहुत
Dr.
बहुत शुक्रिया
Mahab, I hear you.
बहुत शुक्रिया मैं उर्दू समझती हूँ लेकिन मेरा उर्दू अच्छा नहीं है so I understand very well but I don't speak so well so if you feel very much more comfortable in speaking in Urdu please don't stop on my account शुक्रिया
all right. But I think all my speakers they'll be comfortable talking in English. Yeah. So I just want to give Severin. I just want to give you a heads up and a follow up of our last webinar that we conducted, so that you are at speed with us. So in our previous session, we discussed about the overall scenario of social protection in Pakistan, that what are the policies of the government, and how the government is trying to tackle the whole issue. And there were three or four very pertinent issues that came into the discussion, and one of them was that if we take the case of Balochistan, we can see that in Balochistan we need to work differently than the other provinces, because the poverty index is very different in Balochistan compared to other provinces. And then we also realized that there is a governance issue as well in our province that need to be sought out. And we also talked about going universal with the health provisions or with income provisions. So we also talked a bit about this. Then we were joined by Dr. Safdar, and I hope that Dr. Safdar will be joining us today. But if he is not, his spokesman is already there with us, Mutiul Rahman Saab, and he will give us a holistic view about the unmet needs in Balochistan, about the social protection. So what I'm contemplating, and I reckon that we should make this session a more sort of a roundtable discussion than just making it presentation wise. So if we make it more interactive, I think that it will get more interesting. So this was just a brief overview, and I would like to also tell my audience about our organization, that we have a think tank in Balochistan, which goes by the name of Balochistan Council for Peace and Policy. We started it in March last year, and we realized that, especially in Balochistan, there is no think tank that can give the government some advice based on evidence, because mostly what we can see is that not only in Balochistan but in all over Pakistan, we mostly take decision based on our opinions. Our decisions are not evidence based. And then we thought that, of course, the government, they cannot go out and uh, collect data and do everything. There are always, in other part of the world, there are think tanks who are always there to help the government and give them a balanced overview of things. So for that purpose, we initiated this program of this think tank, Balochistan Council for Peace and Policy. And so we are working. We have given government few policy advice based on the COVID scenario, on NFC award, and right now we intend to present a policy paper which will focus on social protection in Balochistan, and as Dr. Sohail mentioned in his presentation the other day, that Balochistan should have a Ehsaas Plus program, means that Ehsaas program needs to do a bit more for Balochistan. And today our discussion will be around that theme. And I would like to start today's this discussion with Severin, as she'll be talking about the governance issue, which is a very pertinent issue, and we believe that no matter how much resources you employ in any particular area, if the governance issue is not tackled properly, your whole effort will not be fruitful. So, Severin, I'm giving the floor to you right now. You please go with your presentation now. Thank you.
Thank you. Thank you so much for having me. It's a pleasure to be here. So just as a context, I'm a sociologist. I've been at Habib University for since 2015. I am a former policy analyst for the government of Canada. Canada is a welfare state. We have also people in faraway regions, including disadvantaged minorities in the form of Indigenous communities. And they very much suffer from exclusion, social exclusion, and even prejudice and systemic discrimination. Up to now, they also have had problems accessing equal access to universal health, which we have, but they live so far away that the outreach of those services makes it very difficult. So again, I come from a context that is, in a way, it has a lot of parallels. It's not equal, but there's a lot of parallels. I think that from the point of view of governance, the first thing I have to underline is the notion of lines of accountability. The lines of accountability from the top to the people administering the money, to the top to the people who are, recording the data. It's very, very important to have very clear lines of accountability of who is responsible for what, and how is the reporting of that performance sort of integrated into the cycle of audit and evaluation. These kinds of checks and balances ensure that money is well used, that money is not wasted, and again, it sanctions. It seeks to reduce the possibility of corruption and mismanagement. So there should also be clear rules about managing the funds and managing access to the funds. I was listening to the previous presentation, and I think that there are serious issues that also emerge from some dissonance between the goals of the program and how it's going about to reach the people who are in those goals. So, reaching the most vulnerable, for example, who are these people? We're talking about people who, to a large extent, don't have access to technology and don't have access even to WhatsApp. Who may not even know how to connect to WhatsApp. We are looking at the abundance of street kids in cities. We're looking at elderly people who have no computer or internet connection capacity or skills. We're looking at very poor families that have a large number of kids. Even the number of out of school children in Balochistan is up to 70% in the latest statistics, especially since COVID. So we're looking at very serious disparities between Balochistan and the other provinces, and on that I completely agree that Balochistan needs programs and an approach that is distinct, but particularly these lines of accountability from the federal to the provincial, all the way to the TESIL, and the people working for the TESIL. It's very important for them to know what is their job, how are they meant to report on their performance, and the supervisory function. because again, that's the only way that we can ensure that these resources are not wasted, because we are operating in a context of very limited resources. The other one is, again, with regards to governance, is the idea of capacity building. You have people who don't know how to go about to reach the most vulnerable. They don't know how to go about even inputting the data in a correct way, or or administering the forms and the paperwork in the right way. So the capacity building is, these people need training, and they need it fast, and they need it efficiently. So again, because the program is already rolling, and so I think it's very important to make sure that the people, all the way to the people who are administering the resources at the level of the citizens, that these people have the appropriate training and appropriate instruction on how to not only dispense those resources, but also report on them, because that data is essential for continued funding to trickle down. So the capacity building is one. The lines of accountability is another one. Again, I think this was said in the previous session, is to depoliticize the administration, and that goes down again all the way to the TESOs, all the way to the local administrators. We are looking also at the need for outreach and having specific outreach campaigns to reach specific populations, and populations, what I would call high needs people, who are not necessarily, who are having trouble to access that funding and access those resources. We were talking about disbursement of resources, but I think that in those para-public, or what we call public-private partnership, we have to look at other ways of facilitating, or let's say maybe not facilitating, but improving the quality of life beyond what is already disbursed. For example, subsidized electricity, or even free electricity if under a certain threshold of income. We are looking at the absolute need for subsidized housing all the way to the regions, in the faraway regions, for people who don't have access, who may lose their home for whatever reason. We're looking at the need for free water. Water is a big issue, but when you're poor, the need to go get water and walk along a very far away to get water, that's wasted human resources. So we are really looking at important needs that the private sector needs to the sector needs to step up its contribution to civil society. It's not just about free healthcare, because we talked about universal healthcare, but universal healthcare, people are more sick if they don't have the basic needs like water and housing. So of course, you want to reduce the dependence on healthcare. You want to make sure people have food, housing, water. So again, there are programs like food stamps. There are, I think again, there could be partnerships with food sellers, food distributors. There needs to absolutely have some partnerships with water suppliers, and to ensure that this water reaches those disadvantaged families and disadvantaged people. We are looking also at free education, which was something that was talked about. But I think that the urgent need for there is if we look at demography, we're looking at a youth bulge right now, right? There's a majority of the people in the whole country, but also in Balochistan, are under the age of 30. And you are looking at a reality where these people are already disenfranchised. And many of them are either illiterate or lack numeracy skills. And, there isn't enough schools. Access to colleges is not, especially for those in regions. So, I think we need to really look at new strategies, particularly with vocational training. People say entrepreneurship, business. Give people skills to be self-employed. Give people, educate them so that they can be electricians or plumbers or repair persons, right? Teach them skills that, and of course we can also go towards technology, and that's very much needed. But I think the first priority is for Ehsaas to sort of, let's say, spread out and be more responsive to the current needs for employment. And when we talk employment, I'm also including self-employment, because the dependency on businesses to provide jobs, there's never going to be enough jobs for the number of people who need those jobs. Never. There will not be enough jobs, no matter how much investment and enterprise open up. So we need to train people to either start their own business or be self-employed. These are the only two solutions. So again, I think that in terms of governance, it is the people in charge that need to see what are the needs within their community and say, oh, okay, well, here maybe a vocational school for these and these and these trades would be useful. And it is, again, through protracted consultations. You need to constantly consult. It's not just one series of consultation and it's finished, and then we don't consult for another 5 years. No, the consultations have to be ongoing, so that the community is constantly included in the decision-making process. And, to increase the number of women who are consulted and the youth, young adults. Again, it's very important, because the disenfranchised are the ones who suffer most, and they are the ones who are most vulnerable. We know, for example, that women spend a larger proportion of their income on family needs as compared to men. Men tend to keep a higher proportion for their own leisure or their own pleasures or their own, and it's interesting that, this money is better used by women. And women are used to also, distributing these funds for the welfare of their children above their own needs. And so we really need more women at the table. We really need to include people with disabilities, families that are dealing with children who have chronic illnesses, mental health issues. There are a lot of factors that inhibit productivity in society. If you don't, if the government and the administration ignores those, then poverty itself is a bigger issue, right? Poverty itself is not just, here's some money, we've given the money to the right people. It's also about, ensuring that these people have the capacity to work, have the capacity to go to school or get some training, have the capacity to use those apps or mobile, So how do we ensure that this capacity, that these other elements of poverty are tackled within the Ehsaas system? And I think that it brings into play some partnerships with other departments. So it's not just, I think that it is a multi-department, multi-ministry issue. And I was even thinking about the large families of people who are undocumented, who may be of Afghan descent, but their kids are born in Balochistan, and they should, by law, if you're born in Pakistan, there's a law that says if you're born in Pakistan, you are entitled to Pakistani citizenship. But if you're undocumented, there are a lot of blockages with Nadra and things like that. Well, these people have large families, and they keep on growing. So if they are, 600,000 right now, in 10, 15 years, they're going to be 9 times that number, or 8 times that number. So these are growing communities, and in Karachi we're seeing it. They are growing communities, and so we need to regularize these people. There was a promise by Imran Khan at the beginning of when he was running for his first term, that he would regularize people without documentation, particularly the Afghans. I think that needs to be done. I think it's part of the problem. They are part of the most vulnerable. How can we continue to ignore them? So the administration, again, needs to, in terms of governance, the Ehsaas program needs to branch out to other ministries and say, what do we need from the other ministries to solve the problem for these groups or those groups or those groups, right? So it's the idea that local communities need to say, well, we have large populations of undocumented Afghans. We need to do something about them because they are the most vulnerable. Okay, so how do we bring that back to the federal, right? From the local up to the provincial, up to the federal. So I think there needs to be two-way communication between all the departments, right? From the local, it's really not just a top-down thing right? And then data goes back up. No, it's not just data. So there needs to be, a sort of protracted consultation, ongoing consultations. The information needs to trickle down, but also trickle up. There needs to have, and the need for depoliticizing the administration is, because of that, very, very important. We have to tackle, obviously, discrimination at various levels for different groups, because again, they are the ones that suffer the most. The Hazara, for example, they are a small community that is present in Balochistan. How are they? How is the program reaching them? Right? These are examples of excluded communities who are suffering. But if the programs at the local administration level are not targeting them, they will become invisible. They will remain invisible. So in order to ensure that demographically we have good data and that the funds are being distributed equally, because that's the premise, right? It's equal distribution or fair distribution to the people who need it most, then I think that we're looking at that. I think that the administration needs to, I think at the level of governance, administration, especially in order to ensure sustainability, the sustainability of the program on the longer term, is to incentivize private sort of donation, perhaps with a tax rebate, to create ongoing funds on a yearly basis, because I think that people with money would prefer to get a tax rebate for money that they invest directly into the Ehsaas program. So incentivizing at the administrative level the donation and investment of private funds, whether it's private individuals or citizens or businesses, right? But it's incentivizing those investments so that the funds can be maintained over a long period of time. What I would suggest also is to create a balance, perhaps with economists and professionals, to create a balance between a percentage of funds that can be disbursed and a percentage of funds that would remain in an account that just grows and live off the interest, right? So sort of like an endowment, like an Ehsaas endowment fund, whereas the capital of those investments is not being spent, and the accruing interest can be spent on people. And this can be regional as well. So the provincial government could also do that. So in order to attract, to create the Ehsaas Balochistan Fund, to attract private investment into the fund against a tax rebate for taxpayers, I think that would be, an interesting way to look at the sustainability of the financial sustainability of the program, because we don't know what government will come next. We don't know. We don't know if the level of interest in poverty alleviation will remain the same. I think that the last point I want to aside from fighting corruption, checks and balances, outreach, capacity building, training the public servants, I want to say that the final point I want to highlight is a rapid and radical investment in infrastructure. People in the regions need access to internet as quickly as possible. They need access to water. They need access. So there is a need for infrastructure, because basic infrastructure, does increase quality of life and living standards. And then you have right away the means to do other things, right? If you have access to water, you can work, or you can get training in order to work, and your days are not spent fetching water instead. So there are some tangible realities where, again, people need access to the internet in order to get training, because if there's not enough schools in the first place, well, it's very easy to produce online training, right? We are already, because of COVID, we're already living that reality of developing the education system online, right? And so I think that there's a need for investment in infrastructure to ensure that the most vulnerable have housing. As I said, subsidized housing is necessary. Access to water in close proximity, electricity. You can't have internet without electricity, so it's all goes together. So again, bringing all the different ministries together so that there's, seamless dialogue and plans to develop those infrastructure, and again, involvement of the private sector. So I touched a lot of information. All of this needs to be properly recorded into databases so that at the end of the day, you have data on every service provided, and every single person who has benefited from those services. So that's all I have. I know it's a lot, but of course it's idealistic. I know I know it's very idealistic. I'm operating also with the what would be great, but I know that there are tangible limitations that I know my colleagues will be discussing following my presentation. Thank you so much.
Thank you very much, Severin, for a very comprehensive and holistic view about the governance. And the emerging theme, even from the last webinar, was also we touched on this issue of capacity building and public-private partnership. And of course, the government need to understand that it is not about only giving cash to the people or just giving them universal health. We need to sort of create an upstream approach where there is a conducive environment which build the capacity of the vulnerable lot, and we empower them. So now I'll move to our second speaker. So Mutiur Rahman sir, if you can hear me, please unmute your mic and you can start with your presentation. He'll talk about the unmet needs in Balochistan, and he has a presentation. So will you be uh, sharing the screen, or should I do it for you?
I'll do it myself.
All
I'll
right,
do it.
good, good. Okay, please carry on.
Uh, uh, it's just that I'm new on this uh, meet thing. So I hope you could see this screen by now.
Yes, yes, now the screen is
All right.
coming. Yeah, it's there. Yeah, just open the presentation, please.
So thank you very much, Mirsab, for having me on this productive session on social protection. I believe this session is the continuation of the previous one, which was held a day before yesterday. Uh, so I would be continuing our discussion from that point of view. Also, it's always good to have yourself, as in myself, as a speaker when many of my teachers are present in this webinar. Dr. Alia, she's here. Dr. Nasir Iqbal, he's also here. So my teachers are here. So I'm very much pleased, in fact, to have those guys with me. Okay. In the last day before yesterday, our executive director, Dr. Safdar Suhail from Social Protection Center, comprehensively explained the contours and the broader idea of what type of social protection need uh, are required for Balochistan. And then there came this idea of Ehsaas Plus and Ehsaas Plus Plus. So he gave that idea. So my presentation would be actually a continuation of that debate which was generated in the previous session. I will be talking about more into the specifics of where Dr. Safdar Suhail has left that debate, the philosophical debate between Dr. Alia, Ma'am Zubaida Islal, and Dr. Safdar. So first, this presentation will be of four components. I'll be talking about the defining the social protection scenario of Balochistan, mapping the social protection need, and the way forward. So far in Pakistan, how do we know about social protection? It's mainly from the international institutions like the ADB, ILO, World Bank. We know this work on social protection more from the participation of these international institutions. ADB define and target social protection in terms of clientele-induced social protection, the targeted social protection. ILO goes with the life cycle approach for social protection, as we all know, and World Bank, of course, goes with the social risk management, social risk assessment, mitigation approach. Unfortunately, in Pakistan, we couldn't have much of knowledge produced on the theory on social protection so far. So we are adopting whatever is given to us, I would say, from the international organizations. Uh, However, what at Social Protection Resource Center as a premier think tank, we believe that Pakistan need to come up with its own definition for social protection. You see, if we talk about Pakistan, a developing country, uh, with a very resource constraint with us, revenue constraints, and the income economic activity constraint. So what we need to do is to come up with our own definition, which includes the realities of our country. And we are talking about social protection for Balochistan, so that should include the realities of Balochistan too. So what we believe, that the social protection needs to be transformative, that given that there are provision measures, there are preventive measures, there are promotive measures, all three are given in the definition of institutions, international institutions. We believe that transformative measures, that your social protection should lead toward transforming your economy and your society. So I will explain further in the next slides how does it interact with what we are proposing as a think tank. So we believe that social protection needs to be transformative in its inherent nature. Now, since there is this phase in Pakistan where we are creating this knowledge, so it is high time that we debate on this topic and we come up with a proper inclusive definition of Pakistan. And Social Protection Resource Center, we believe that the transformative social protection is the need of Pakistan. Pakistan, evolution of social protection in Pakistan, as you can see, started rightly after independence. In 1954, government had this government servants pension cum gratuity scheme, provincial employees social security schemes, and worker welfare fund came 1971, zakat and usher scheme, social assistance, which is basically 1980s. 2008 we had the BASP, and now we have Ehsaas in 2019. So this is a chronology of the social protection institutions we have in our country. A quick glimpse, this shows you that we started with the social security based institutions, and now at the end, in 2019, we are more into social assistance based institutions. I'll explain this fact a little further. This is just to show the evolution of social protection in Pakistan. Okay, so social protection institution at sub-national level. In Balochistan, we have Zakat and Research Department, Education Endowment Fund for Balochistan, Worker Welfare Board, Finance Department, and then a very important, Balochistan implies a Social Security Institution. This is an institution which is needs to be given more in terms of domain, in terms of targets. So BASI is, I believe, an institution that needs to be strengthened for Balochistan. Okay. Social protection scenario, Balochistan, as we all know, and Mir Sahib has already said it earlier, the incidence of poverty is very much very high in Balochistan. It's 71%. And the intensity is 55%, which is again, if we go to the MPI definition, which is alarming. So 71% is the multidimensional poverty in Balochistan. BASP is currently giving to roughly 5.7 million individuals the monthly grant, cash transfer. Out of that, 5.7 million, 174,000 are from Balochistan. That becomes 3% of total BASP beneficiaries, I believe. And out of that 174,000, 31,000 are older people, old age people, people with more than age of 60 years. That's the people who need social assistance, the cash transfer thing that we know. One data is missing from here. I should have that, but unfortunately, due to the data limitation, I couldn't show it. That's the data on the person with disabilities. They also need social assistance, but I couldn't get some authentic data on this. But that should also be there. Social insurance. Okay, now Pakistan has total employed labor force of 60 million, out of which 23 million, 38% are in agriculture and 37% are in non-agriculture. And then we define the formal sector in terms of non-agri activities from industry and services. And we have 10 million around, out of total 60 million, the 10 million are in the formal sector of Pakistan. Now coming to Balochistan, according to the labor force survey data, we have 2 million labor force from Balochistan, out of which 34% is in agriculture sector and 66% is in non-agri sector. And that 66% becomes 1.34 million. And that 1.34 million, out of that, 0.5 million, 500,000 people are in the formal sector. Out of 2 million, we have 500,000, 1/4 in the formal sector of the economy. That any intervention related to the social protection which is there, that goes to the formal sector only, and not to all, of course. Here are the other stats. Percentage of employed labor force entitled to social protection entitled to social insurance. As I told you, there are 2 million labor force, 0.5 million in so out of 2 million, 16% are entitled to old age pension, 15% are entitled to medical support, 13% are to family support. But by family support, we mean if there is sudden death in the family, the institution will provide some assistance to the employee. Fee reimbursement and disability support is to. So out of 2 million, if you say this is the scenario. And if out of 0.5 million, which is the formal labor force, 65% are getting the old age pensions. Even from within the formal, it's quite alarming to see that from the formal sector employees, only 65% are getting the old age pension, 60% are getting the medical support, 53% family, and this is the latest labor force survey data we have. Now, employed labor force in Balochistan, 14% are in the public sector and 86% is employed in private sector. Now you see, old age pension, people who are employed in public sector, 90% of them are getting the old age pension entitlement. Only 1% is getting that in private sector. So you see 80%, 86% of the total employment of Balochistan is in private sector. But out of those, only 1% is getting or entitled to the old age pension. Family support, 0%. Fee reimbursement, 0%. Disability, 0. Medical support, 2%. So the public and private contrast in Balochistan, it's very high, it's very deep. So entitlement receivers in the private sector are negligible, as you could see. Only the public sector is supporting to the employees, but the public sector employee are only 14% of the total employee. Now you can see the gap which we have in terms of provision of social insurance to the employed labor in the province. Okay, mapping the social protection need. At SPRC, we actually try to map, rank the districts in Pakistan according to their social protection need. We have this 21 variables of social insurance, market policies, social assistance, and we try to rank the entire Pakistan in terms of their social protection need, from the higher need to the lower need. So that's what we try to do. Based on the formula we developed for that, the normalization, and then getting the component-wise score, and then the total score. By that total score, we will get a range of -6 to 6, 6 for minimum social protection need, and -6 to the highest social protection need of the district. So this is the map of our results of social protection need. So the more the red mean the higher the need, the more the green means the lower the social protection need. Okay, the data for Punjab, KP, and Sindh were publicly available, but there has been a severe issue of the data for Balochistan. So three things. Number one, district-wise data on Balochistan, even for the labor force survey, is not available. It's only division-wise, so that's why you could see the Balochistan in this map is given a division level. Okay, so district-wise is not available. Even when it's division-wise available, many of the variables, we don't get the data for that. We have to extrapolate, interpolate the values. For example, the mix data, latest mix for Punjab and Sindh, we have values of 2017-18. But the latest mix data for Balochistan, it was in 2010. And even in 2010, many of the variables were missing from that survey. So we don't have as such data. So outdated micro data sets, the mix 2010 is available for Balochistan. That's a problem. So probably safely speaking, I would say this representation of Balochistan, these results, we may not call it a very accurate if we talk about excuse me, can you guys hear me?
Yes, yes, we
Hello,
can hear
sorry,
you.
I
Yes.
thought I lost the connection. Anyway, so safely speaking, the results of Balochistan, I wouldn't although for Punjab, Sindh, and KP, I'm very confident about the results. But for Balochistan, due to the lack and outdated data, I wouldn't be very certain about the results. Dr. Alia is here. She would explain how we have been facing this issue of calculating the index for Balochistan. She knows because we have been taking guidance from her for the calculation of this index. Anyway, this is the if we have the latest mixed data or LFS data for district level, perhaps we have a better results for Balochistan in this case. So this is what we have tried to achieve to show the ranking of need-based ranking, social protection ranking of Pakistan. When you correlate this need-based social protection score with the multi-dimensional poverty, there is a positivity and a positive correlation between the two. So as you can see, Balochistan is in red. So higher, the Balochistan districts, divisions, sorry, are on the higher side, which means they need more social protection, and then the poverty score is also high there. As you can see from this chart. Okay, so what we believe, coming back to the discussion and the debate on the knowledge production on social protection, particularly with reference to Balochistan, which Dr. Safdar has comprehensively explained, I would sum up my presentation on that note where he left. Number one, Pakistan need to redefine the concept. Again, Ms. Severin also mentioned this point, the upstreaming approach, that I would say we call it the transformative social protection regime for Pakistan. Make such social protection instruments, policies, which are transformative in their inherent nature. That's what we need in Pakistan for now. Pakistan should focus, and Balochistan too, on more on social security and social insurance as compared to social assistance. And as you can see from the map, social protection need is not uniform across the country. And that should be social protection as a system need to be decentralized with the enhanced role of provincial institution. There, I would call the enhanced role of BASI, Balochistan Implied Social Security Institution. that institution has a lot of potential for every province, of course. That institution, implied social security institution, has a lot of potential to get us into a transformative social protection regime in Pakistan. That's it from my side. I thank you all for your patience and time. Thank you.
Thank you for a very informative and in-depth presentation on Balochistan. So now I would like to move to our third speaker, Dr. Nasir Saab. If you can hear me, so you can unmute your mic and sir give your presentation, please.
Thank you so much for giving me this opportunity to speak on this forum. So
Thank
as
you.
Ati said, there is a huge, like, special differences across the provinces. And when we talk about even at the lower level, at the district level, we can also find a big differences in terms of provision of these services. So I'll just start with the two basic part of this whole exercise. One is the educational poverty, and other is the health poverty, that is on the social side, and the next one is the environmental poverty on the more on the climatic side of this whole issue. Then we can frame basically the question of how we need to deal with this issue. So I have done a couple of studies on this, the education poverty as well as the health poverty. And more recently, I try to see how these social protection systems basically will help to tackle these two issues. And when I try to map these two key elements of health poverty as well as the education poverty at the district level, you can imagine that the Balochistan basically is the highly deprived region in the Pakistan. So I try to construct a comprehensive indices for health poverty as well as education poverty using a multi-dimensional approach. As earlier said, that there is a phenomenon of multi-dimensional deprivation. So I based using the information that the government of Pakistan used to construct a multi-dimensional poverty for Pakistan. At the district level, I expand the indicator used in the education as well as the health to separately track the situation. So the provision of services like the health and education is very low. That's evident from these by these two studies. Now, coming to the climatic issue and the environmental poverty, then the other issue that is more urgent for all of us is to the environmental poverty. More recently, I have published a paper in energy policy on how we can measure the environmental poverty at district level. Again, I try to figure out the use of environmental services, especially the modern fuel, the clean water, the proper sanitation facilities, and so many other stuff. So again, we can find a clear distinction between the provision of these services in the Punjab as well as the Balochistan. Even the recent survey published by the HICE and the PSLM by the PBS clearly document that around more than 60% households are deprived in terms of environmental services in Balochistan, and within that district, this deviation is more important. So whenever we are talking about the how we need to overcome these deprivation, and we talk about the different interventions and so many steps, then probably at the first stage we need to understand the needs of those people, whether they are the monetary poor, whether they are the multidimensional power in terms of health, in terms of education, and most importantly in terms of environmental services. So these are the four different elements that we have to consider while designing any support mechanism to address the vulnerability of these people. So the literature basically and the data shows a clear evidence of a huge deprivation. Even in some districts, more than 70% people live below these poverty lines, especially on education, health, and within health, if we can see that the maternal health and the child health, these are the key issues. The couple of weeks back, I was interviewing Qazi Isa from PBS, and he rightly said it is like shameful for us when we see the maternal health in Balochistan, and the dying ratio is much higher. Even it's much higher as compared to the African countries and other very low income countries. So this is the real situation. Once we have a clear understanding of the real issues and we have the situation analysis, then probably we will be able to track some sort of policy intervention that help to address the specific needs of the regions. Whenever we talk at the federal level, we say, no, this cash transfer is very useful. It is useful, of course, for everyone, but it is not effective to address the deprivation at the very low level. You can do some sort of consumption smoothing by using a universal, like a one-go cash transfer program, but for specific needs, especially women-related needs, education-related needs, and environmental-related needs, you have to focus on the domestic needs. Given this scenario, I try to propose like a package-based model. Earlier, I present this model to Sania Nishtar when she was chief guest in one of our webinar on this social protection. I try to highlight, look, I can judge my needs in a better way rather than the you people can ask that this is a package that you have to follow. So you give me an option, I'll see the household size, I'll see the basic need. If I have a more elderly people, more like vulnerable people in terms of health, I may be more need of health facilities. If I have a younger kids, maybe I am more need of education facilities. Similarly, if I have an adult in the family and they are lacking some sort of business, maybe I need some sort of graduation package that ultimately uplift my economic opportunities. And even in some cases, if I'm old and the family is basically living very hardship situation, then maybe I need a direct cash to support my consumption needs. So based on the real need of the respondent, I design like the 4 different packages. One is a graduation package where we can give the employment opportunities to the adult people if there are 3 to 4 people in household and they don't have like that situation. Another could be like that the health package. And in this, we have to focus on the health need of the household. Another could be the education package that mainly focus on the education part of this whole exercise. And we need to club in a way that these interventions should be paired in such a way that the needs of the people should be addressed. And fortunately, BISP have a lot of data, especially the National Socioeconomic Registry, and they have collected nationwide this data set more recently. That would be very instrumental to basically determine the needs of the household. And once we determine the needs of the household, we may revisit the targeting method. Because for education, we might have a different targeting method. For health, we might have a different targeting method. For employment, we might have a different targeting method. And for ultra poor, we might have a different targeting method. So we have to readjust this targeting method based on the different packages that we can define. So then probably we will be able to address the real issues, not only for Balochistan, but also the other deprived district in the Pakistan. This like a one fit intervention is good to some extent by giving the consumption smoothing, but it might not help to alleviate the real issues in the long term. So my suggestion is whenever we talk about the policy intervention, we have to look into the real needs of the people. We saying that this CPEC is very instrumental for generating employment opportunities. Is there any study that show this will produce actually employment. I did some basic analysis to track the district those are located around the main corridor of the CPEC. And if we talk about the employment opportunities, we need to have some sort of skill set. We need to have some sort of human capital. We need to have some sort of what we call it a rural infrastructure in terms of connecting these rural hubs with the mainstream. And unfortunately, when I map these data set with the well-off district, we can easily find that these districts don't have any human capital. They are lacking in terms of regional connectivity, especially from rural to the main hub, and also the fragile, like the institutional situation in that district. So if this is the endowment, and with these endowment, we cannot say that the CPEC would be the game changer. So for that, we have to revisit our entire policy paradigm. First, we have to identify these districts and the endowment that they have, and try to develop the human capital as per the inputs from that districts. So if we are trying to promote hoteling, if we are trying to promote tourism, if we are trying to promote industry through special economic zone, we have to develop the required capital at the local level. Once we have that the specific human capital particular to that region, then we also need to focus on the local connectivity. Once we have these basic endowments, ingredients, then probably we can say that the broader level, macro level intervention would help to alleviate the poverty. So these are all the few thoughts that need to be considered when we say about the policy paradigm, we say about the policy shift, we say about the specific intervention at the province level. We all have to figure in all these statistics and the initial endowment. Without looking into the initial endowment, whatever policy we try to implement may not be useful. I stop here.
Oh, thank you, Dr. Saab. Indeed, it was a very resonating presentation by you. And when I was doing my PhD, I did my PhD on all the health partnerships they are taking place in Balochistan. And when I was collecting my data in 2014, and by end of my thesis, I came up with some findings which I find that they are still valid in the scenario of Balochistan and in Pakistan as well. Those were that when we are planning any sort of an intervention, or when we are taking any sort of a decision, we try to exclude many stakeholders that should have been the part of that particular intervention, as Dr. Saab mentioned just now. So now, first, I also have two experts, Dr. Alia with me and Dr. Sohail. I would like first Dr. Alia to comment on these three presentations, and then we'll go to Dr. Sohail, and then I'll put some question in front of the whole panel to sum up our whole discussion of today. So, Dr. Alia, if you can hear me, ma'am, please.
Yes, I can hear you, and thank you for giving me the opportunity to comment. I think, first of all, I would say that this is a unique webinar or a series of webinars on Balochistan that, I've been fortunate enough to be a part of, that really is talking of evidence-based policy formulation for uplifting and supporting the livelihoods of the people of Balochistan, whether it is through social protection or through better governance or education or health. So I think it is a very I would say inspirational way of looking at the whole landscape of Balochistan, something which is totally missed out when you go to these, five-star hotel conferences on Balochistan, where only the natural resources and the geostrategic location, especially because of Gawadar of Balochistan, is highlighted without really getting into the roots of how all the potential sort of mineral wealth and natural resource wealth of Balochistan is going to translate into better quality of lives and better intergenerational outcomes for the people of Balochistan. So I congratulate you on bringing a set of speakers together. From the first presentation, thank you very much. I learned about Habib University's stance of research on Balochistan. Very, very valid points, and especially because I've been struggling with the Labor Department of Balochistan for years in order, for them to be capacitated in order to carry out certain labor market reforms. I totally agree with whatever was said about the governance structures. And Balochistan is unique in terms of um, being sparsely populated and having pockets of population which are geographically distanced, but it's not the only place in the world with this kind of landscape. So there are solutions, but the will to search out and implement those solutions has been missing, and that has led to many, many conflicting and very troublesome situations in Balochistan, troublesome for the rulers, and which they have tried to quell and quash with different types of forces, including the military force, which is obviously not a very good idea for long-term sustainability. So, and then we have this very, very special social class system. So what I'm trying to say is, whatever the picture that Mati's presentation, and by the way, Mati, I'm proud of you. You did a very good job in presenting the social protection needs of Balochistan, and I'm very proud to be associated with that report, because I think it is a milestone report in terms of struggling with all the data constraints for Balochistan and still trying to come up. I remember when we got the green color for Balochistan and not red as we expected in terms of the intensity of the need. But then we thought that we will present the green color, but with the provisos that the data is much, constructed in the sense of statistical construction, averages, extrapolation, interpolation, to come up with this index for Balochistan. So I have also a good idea of the weak status of the Balochistan Employees Social Security Institution, and the issue of the pensions, old age benefits, because many of the, there is very little industry in Balochistan, and the mining workers, because of the mineral resources in Balochistan, they are really in a very, very pathetic state as far as labor standards and any kind of welfare, labor welfare benefits are concerned. So I think behind these numbers are institutional weaknesses. I will not say that Balochistan is entirely financially resource starved, because even after the last NFC, we have really not seen the fruits of that enhanced share that Balochistan got from the NFC award, translating into better social indicators and better, quality of life indicators for the people of Balochistan. So somewhere along the line, the resource allocation is less of a problem than the resource utilization is. And we cannot, just convince ourselves that it is going to continue to be a capacity problem for the next 70 years. I mean, something has to be done. Either technology enabled solutions need to be implemented so that they make up for the inefficiency of the human resources who manage these financial resources, and to overcome the for example, the geographical constraints of which are there in terms of delivery of public services. And I'm sure that there has been a big concern by civil society, such as the concern shown by Balochistan civil society organizations, as the one that you are heading, Mir. So I think all these, and of course, Dr. Nasir's presentation reinforces or sort of dives deeper into the first two presentations in terms of really bringing out what poor governance, what poor monitoring and evaluation, and what poor provision of social, whether we want to call it, whatever social protection there has been for the people of Balochistan, how it has impacted the lives of the people of Balochistan in terms of health and education. And I'm also heading the National Poverty Estimation Committee, and this time we have been tasked to present the provincial profiles also. So a very, very preliminary data analysis says that Balochistan's poverty levels are stable and stuck at almost half the population living below the poverty line for years and years. So the big question is, what is it going to change the way development and social service delivery is done in Balochistan to take Balochistan out of that trap? So I'll just stop there, and maybe Dr. Safdar can really focus on some very specific social protection related issues. I wanted to basically give a more of an overview that I got from the three presentations put together. Thank you, Mir.
Thank you, Dr. Alia. Thank you for your valuable comments. And when we had one of our webinar on NFC awards, in that we come to a conclusion that there is a serious service delivery issue in Balochistan, because of which even after 18th Amendment, we are still not able to get the results that we desire for. Even the province has been empowered through the 18th Amendment, but there are issues which are still prevailing. So I'll just go to Dr. Safdar for his comment, and then we'll start our Q&A session. And Secretary Health was supposed to join us today, but then he messaged me that he is busy in a meeting, and maybe he will get free by 4:30. If he does, he can join us. If not, then we can conclude our session without him, and then we can present our findings to the government. So, Dr. Sohail,
Yeah, I don't know what they do in those meetings, Mir.
they just do meetings, nothing else. Is Dr. Safdar, can you hear me?
Yeah, can you hear me also?
Yes, yes, please, sir.
Okay,
You're
okay, that is very good, and good to be a part of this series, and good to have Dr. Alia with us, who is otherwise also one of the founding directors of the Social Protection Resource Center. Uh, without much ado, I take where we left last time. Dr. Alia, you have talked about evidence, and Dr. Nasir, our colleague, also has talked about the evidence. I would say that what more evidence do we need that the things in Balochistan are so bad? 50% people living under poverty line for a very, very long time, since many generations. Uh, so it's not a question of evidence at all. It's a question of doing something really good, transformative with that evidence. Now, that is one of the major key message, Mir Sadat, which we need to take to the relevant people, that the current development model, including the donors' interventions, have failed. Dr. Alia has hinted at one can use the word failure of the additional resources which were brought by NFC. So they have not been able to make a difference. So now that is a very, very serious piece of evidence that there is something uh, basically wrong with the way things are being handled in Balochistan. So uh, I think this is the process of re-socialization of the decision makers and the donors and the people sitting in Islamabad into the reality of Balochistan, which is there for anybody with right kind of eye and heart to see, with multidimensional poverty 70% plus, with 50% people living below poverty line, the environmental poverty that we have, the kind of socioeconomic indicators and health, for example, that we have. So here, my first major point and suggestion, Mirza, would be that the Balochistan government does not need the uh, the like of Punjab growth strategy. You see, in Punjab, you have a big private sector. The things are not that bad. So there they have given their province this Punjab growth strategy 2018 to provide a framework for the development initiatives and efforts of the government as well as the donor. Now, Sindh has an investment framework, which is kind of a governing framework for the development. Now, Balochistan, in case of Balochistan, it has to be a social protection framework. That's what the reality of Balochistan is. We cannot talk about growth here. We have to talk about first uh, addressing the problems of severe vulnerability, which is there. And that's why we believe that what we said last time also, that here we need what we are calling Ehsaas plus plus. So the first thing that your organization and the Balochistan government need to do is to come up with a social protection framework which should be disruptive in the nature. Now that is the second. When evidence is there, but there is a collective inability to work on that evidence, that means there has to be a disruption. Now that is the second framework we need to have in mind, that how to disrupt what is going on in Balochistan right now. Now, one of the popular disruption that many colleagues are suggesting is technology. In the previous seminar, there was a lot of talk about technology, but in case of Balochistan, where electricity, internet penetration, connectivity, poverty, all these things are there. Technology can make a difference, but not that much. And there also, we must use technology. For example, in case of Balochistan, we need a different kind of a wasila-e-taaleem. You know, the way Ehsaas has formed wasila-e-taaleem, it needs to be radically modified in case of Balochistan, needs to be big, and we need to bring online education with the wasila-e-taaleem in case of Balochistan. Now, Dr. Nasser has talked about the packages. Health is extremely important. And last time also, we discussed it. There, in case of Balochistan, health insurance would be the worst choice that Balochistan can make. And it would be in the same development dynamic that we are talking about. Here, we have to talk about in-kind provisioning of health. And it's a matter of detail that how do you go about that. Now, one little point on Mati's presentation. Apparently, one can say that, look, I mean, in case of Balochistan, the formal sector employment is high. Let's say this is 25%, and then some figures appear decent. This is basically due to the preeminence of government service counted as a formal sector. Otherwise, formal private sector in Balochistan is small, number one. And then Muti has talked about the thinness of protection. Hardly 1% people have any kind of protection. So in a province where labor market interventions cannot work, where social security interventions cannot work, where social assistance of a income transfer type has been very, very thin and problematic, there then we have to design one such program which has the features of a universal distribution system. And here in this particular case, I would refer to a study which was initiated by the government, if I remember correctly, by Dr. G.M. Arif. Dr. Alia can correct me on that. After the last NSER of 2010, I guess. And it's written in that report that in Sindh, they found the evidence for overreporting, and in Balochistan, they found the evidence of significant underreporting. So what makes us believe that this time NSER would throw better results? So in that background, as the Minister Zubaida Jalal also desired us last time that we need to come up with the proper recommendations. Let's go to that level that if we imagine that the current development model is not working and we need to disrupt this model which is going there, and I wish the Chief Minister of Balochistan was listening to us, and we can request him to stop the current development model in its tracks, including ADB and all the donors, because that is being wasteful, and then come up with an Ehsaas Plus program. So there, what I'll suggest, me, Saadat, is that we do another webinar. We take one by one all the major mandates of the current Ehsaas program, and we develop a matrix where we define the relevance in terms of highly relevant and least relevant, and take out some of the mandates which are totally irrelevant to Balochistan from Ehsaas program, and then add the new ones which are needed exclusively for Balochistan. And that is what should make the Ehsaas Plus for Balochistan, situated in the Balochistan social protection framework under which the Ehsaas works. Ms. Severine is a Canadian national, I understand. Canada is also a federation. Even in Pakistan, social protection is a provincial subject. That is how we promote the right-based approach. When the center parachutes the money, little money from above, that is more in the context of pity and compassion, not in the context of right. Now, in the context of right, this is at the provincial level Look at the example of Nashwanuma centers. Now we are saying that we would have Nashwanuma centers in Pakistan, like 68 centers all over Pakistan for nutrition for the kids to come and have their lunch. Can it work in Balochistan? It cannot work in Balochistan. So in Balochistan, there has to be a different approach. In case of Balochistan, the first presentation, Ms. Severin also and Dr. Nasir also talked about that. Water is the key. Now, one of the most important Ehsaas plus intervention has to be in the water. In India, for example, toilets was considered as one of the major protection against disease and one of the major social protection, and government massively spent on making the toilets. So there, I think we should do two things. One is that when we start talking about social protection, we bring in all the other aspects like public-private partnerships, like other development interventions, which are fine in their own way and right. But then we enter into a general growth strategy of Balochistan. So I think in this document that you are preparing, we talk only about social protection. The other initiatives can be there. There, I think we can take some help from the what they are calling it a new welfareism in India. We all know that India is not big on income transfers, and that needs to be looked at, that why they are not big on income transfer. What they call, the academics have started calling new welfareism in India, has certain features which I'll put before you all, and then I'll stop. First feature of that is that India is not big on income transfers. Then they have this NAREGA, this minimum employment guarantee for 100 days available that people can have. So that is another way to transfer the resources. What does you see? Instead of giving 2,000 rupee per month, if you have guaranteed minimum salary, guaranteed work for 100 days, that would make a much bigger difference. Then India is big on PDS, public distribution service in kind, that responds to the need of people more. But here, our point of view that we shared last time also, that where 70-80% of the population is in need of support, there it's better to go for I would not call it universal universal income, but UBI looking scheme for cash transfers. India has now reduce the focus on the traditional indirect investments on infrastructure, health, education, etc. And they are going for more in-kind supports like toilets, like gas, cylinder gas, for example, or assets to the people who are vulnerable. So in case of Balochistan also, I think we need to come a kind of a different model of social protection. And I would say that if there is political will, if Balochistan can have its own social protection framework, they should tell both the donors as well as the federal government to reorganize their programs, redesign their interventions as per the needs of Balochistan, which the Balochistan provincial government, with the help of organization like yours, determine. Thank you.
Thank you, Dr. Sohail, for your comments. And I would like to tell all my participants that the idea for these two webinars was and is that after these two webinars, we're going to develop a policy advice paper first, which we will present to the government of Balochistan. And I'm sure that they will take into consideration whatever advice we will give them. And once they do that, as Dr. Safdar said, that then we need to look into each aspect separately. So then we can go or move forward on that. So right now, my idea was that I should have at least a group of experts who should come and they should give their idea about social protection. And I'm happy for a fact that the ideas, whatever you people have talked about, they are all resonating with whatever my team has researched and the ideas that we already had in our mind. But we couldn't just go right away and give it to the government. We wanted a backup from expert like you all. So now I'll move towards a brief question and answer session. And first of all, I would like to pose a question to Severin, that in her presentation, she mentioned that we need to move towards public and private partnership. And I have been telling this thing for last 1 year when I have provided government of Balochistan advice on COVID, and I insisted that we need to bring in private partnership, because otherwise you are exhausting yourself, and by doing everything at your own, your performance will decline. So if I ask you that what is the best way to go for a public-private partnership that should be effective? So what would you say?
Mm-hmm. Well, there's different kinds of of private-public partnerships. The first one is just a tender. So you would have, the government would launch, a call for tenders and say to, businesses, we have this need, we need to provide this service, and we need people, we need a company or an enterprise, a social enterprise to fill that need. Give us some estimates and a proposal. And then the public service, will evaluate the proposals and pay those service providers to provide a service that it itself cannot provide. So that happens a lot. And in Canada, we have the Ministry of, public services that actually oversees these tenders. And these can be outsourced. It's basically outsourcing, right? But it's really an admission that the administration itself cannot provide the service that it is responsible for. So that's the most sort of offhand. But in those tenders, there are very, very strict rules and indicators of performance that need to trickle down to the service providers. So, for example, serving the local population in the official language of its choice. Right? In Canada, we have French and English as official languages, and if there's a tender in a far away region in an English province, but the community over there is French speaking, then the service provider would have to provide, and it would have to show that it has fulfilled that requirement. That's just one example, but with regards to social welfare, it would be, these are the requirements to ensure that, these communities in faraway regions get the service. Then these companies would go and do that and would be paid to do so. And so that's, a very simple way to do it. Another way would be to literally leverage a para-public project, right, where the business and the public service would collaborate in developing a service provision endeavor in certain locations. Again, there needs to be very strict criteria in terms of administration and especially in terms of accountability. Because I talked about those lines of accountability. The minute that you offhand a service to a private organization, the government loses some control over the data, right, or over the quality of the service and sort of audit and evaluation. You have to make sure that these companies do provide. The other one that I was talking about is to have these subsidies. So to say to, electrical companies or internet companies, we will subsidize, up to this percentage for these kinds of households, do provide, but you have to build the infrastructure. They will end up making money because the government will pay for that service in lieu of these other people who can't afford it. But they're looking for, low cost services, obviously, because the government is already indebted. So you have to think about how much the government is indebting itself to provide those services. The Pakistani government is very much indebted, and the national debt is increasing, with every year. And it's very important at this point. This is why I was talking about vocational training. It's very important to train the youth of today and the youth of tomorrow to become taxpayers as quickly as possible. Because as long as we don't have a large margin, I mean, we were looking at the employed population of Balochistan, which is in the range of 2 million. But the total population of Balochistan is actually 13 point something million. So you have a lot of people, children, elderly, women who are not employed, who are not paying taxes, and these are technically a burden on the administration. So because they need services, they're the ones who need services. They need healthcare, they need education, they need water, they need access to internet, and they're not. So it's really important, as much as possible, to increase the population of taxpayers within the province. And the only way to do that is to make sure that they're healthy enough to hold jobs, even if they're home jobs, right? And so I think that the kinds of partnerships we're looking for in this kind of setting, especially in a resource scarce context, would be probably subsidies. That's actually it's really quite common across all the provinces of Canada to use subsidized housing and to subsidize certain services. In the Scandinavian countries, it's very, very common. And in fact, if you go to a subsidized housing unit in Norway, they have, it looks like a 5-star apartment. They have swimming pools, it's very clean, but obviously they're being managed with strict conditions on living standards, and those are monitored and constantly audited to make sure that these standards of living are maintained. At the level of just the quality of construction, we're seeing even, everywhere across Pakistan, we're seeing constructions that are in complete decay after 10 or 15 years of use, because it's bad plumbing within the foundation. So, there needs to be, a high level of accountability for those people, for those companies that build those subsidized apartments, because what we're seeing is really low quality subsidized apartments in most places when they're being built exactly for that purpose. But aside from that, I think that the subsidy or the tender options would probably be feasible and welcome. But again, when we start working in social enterprise, when companies start working in social enterprise, it has to be values above profit. It has to be humane, human and humane interactions with a client base over profit, and to offset that probable loss in the profit margin, they would have to the thing I would recommend, with again the approval of the government, is to create tax breaks for these kinds of businesses that are working for welfare. So if a business works for welfare, it can be entitled to a large and significant tax break, especially if it provides jobs, and especially if it significantly increases the standard of living within a particular area or region. So and these there are ways to monitor these outputs, right? The quality of life, you can measure that. There are indicators of performance for that. So it's very important to have very clear indicators of performance for everything that you're trying to measure within a blueprint of, these are the service, these are the goals that, like, for example, access to water, you can measure that. Access to education, and even quality education, you can measure that. But again, you need, reliable data entry, and for that you need trained people, because otherwise people who don't know how to manage and enter data are going to do it, in a manner that can't be extrapolated at a higher level. And again, the province is huge, and there are people far, far away, and those do pose a logistical problem, and one that also relates to the cost of reaching them. So again, it's very important. And what I would suggest is to really involve, I agree with Sardar Sohail, who was mentioning that it's very important for this portfolio to be managed at the provincial level. And because of the disparities, I would suggest that, the total fund of Ehsaas should be proportionately and equitably distributed based on needs across all the provinces. And because Balochistan has a high need, right, in terms of level of unemployment, dependents, the number of dependents per household, these are children, elderly, and people who are not working. So the higher number of dependents means the higher level of vulnerability for those households. So these indicators need to be accumulated and collated in order to make a case for having a greater amount of resources distributed in Balochistan. And again, it does have a smaller, in comparison to Sin, for example, it does have a smaller amount of people. But per capita, it has a higher number of illiterate people. It has a higher number of children out of school. It has a higher. So again, we're going to look at the data from an objective point of view and pick out some companies that can offer the services. And again, I was saying, so when the provinces are in charge of the portfolio, they have to work with the TESOs. They have to work with local communities to look at the local needs. Some communities will have easier access to water than others. Some communities will have a better school that can accommodate more people. Some communities may be better connected with internet than others. So these needs need to be, it's like a census of needs per TESO before you can map out, where the services are needed and get the right companies and the right social enterprises to intervene, to fulfill those needs specifically. I do not think that a blanket one-size-fits-all approach is going to work for Pakistan nor for Balochistan. I think you have to really zone in, right, zoom into specific locations and identify the needs. And you may want to map it out in terms of indexes for basic needs, like again, I mentioned this, water, very important, education, infrastructure, electricity, as well as internet. Those are just, and housing. And then once the basic needs are fulfilled, then you can think about, give people money. But the thing is, when you don't even have basic needs, what are you going to do with the money? So I think, it's like you can have money, but if the water isn't accessible at all, and you need water, right? So I think that first the communities have to voice their particular needs at a local level, map it out. The province needs to map it out, and develop a plan that is responsive locally. I think that's the only way that will end up being effective, and especially in terms of cost savings. And it's only when we know local needs that we can, bring in the right companies, the right social entrepreneurs, the right NGOs. Right? Otherwise, you're going blind. You're going to do this blind. So in order to justify those expenses and those partnerships, I think that's the best way. And usually, I just want to mention that usually local people know what they need enough. I mean, if you involve local people, they will be creative enough to meet their own needs and even develop those social enterprises. So maybe a little bit of, capacity building of the local population, they could end up fulfilling their own needs if they could have those subsidies and that money. Instead of just giving money per household, you could give money for projects to solve those needs locally by local people or with local enterprise. But that would be, again, a project-based approach, in terms of para-public partnership. So yeah, there's a lot of possibilities in terms of format, but I think before you jump into format, you need to figure out the actual needs and what might be the best way to fulfill. For example, electricity, that's a system grid. So it would be a lot harder to, provide electricity unless you develop, electricity based on solar or other means, right? And that's possible too.
Yeah. All right. Thank you for your detailed comment. And now I would like to ask Dr. Nasir that as Severin was mentioning during her comment, and what I can gather is that if we look at the situation in Balochistan, so the things are really, really bad in Balochistan. And if anybody wants to work on it, we really don't understand that from where we should pick, from where we should start. And we were talking about water, and then if we go to water, then we see that okay, the infrastructure is also an issue. And if we go into that, if you look at Balochistan, terrain is a very big issue in Balochistan. We have very hostile terrains in Balochistan. The geography of Balochistan is very hostile, very rigid lands and mountains. They are there, and then we also have security issues in Balochistan. And because of all of these, the development aspect of Balochistan, it is very grim. So if I ask you that that what are the first 3 points that we can pick up and we can tell the government, okay, you really need to focus on these three issues right now, and then we can move forward an aspect of development which will ultimately lead us to a better social protection framework. Yes, Dr. Saab.
I think thank you so much. So as Dr. Sohail Safdar said, so there is need of a very specific social protection system for Balochistan, but that would resulted in the outcome would be in the long term. If we are looking for the poverty elevation, if we are looking for the elevation of education poverty, we are looking for the environmental poverty, we are looking for the health poverty. These all measures are necessary, but the outcome of these measures should become in the long term. What is the need of the time is to take a short-term measure for the economic empowerment of the people. So that would be a starting point for me, as well as maybe other would agree with this idea that the economic empowerment ultimately will be translated into the human capital empowerment, health empowerment, also the environmental empowerment. So that would be a starting point. As we said, there is the bi-directional link between these two stuff. If we focus on the education, if we focus on the health, that the return would be in the long term. But the economic development that is planned at the federal level through this CPEC and other mega projects, we should have to include the local people in these mega projects by giving them a very specific and short-term training. So if like earlier I said, if we are looking for the hoteling, if we are looking for the tourism, if we are looking for the special economic zone, we should have to give them a very specific and short-term technical training so they can generate their own income on a sustainable basis. Like the graduation model that the well-known phenomena in the world, and the various literature supported this, that if we give them some sort of hand-holding with the very specific training, that ultimately lead into a more sustainable transition from the low poverty track to a very decent livelihood. So to me, the short run term intervention would be to focus on the economic empowerment of the local people. Thank you so much.
Thank you, Dr. Saab, for your comment. Uh, now, Matti, I have a question for you as well. When you were telling us about the situation of labor in Balochistan, and you mentioned that most of the labor force, they are working in the private sector and they do not have any protection. And so if we ask the government that look in the private sector, these people, especially the miners, they do not have any good protection for them or for their family. So of course the government will say that we cannot do anything for the private sector. It is their own job. So what can be the middle way for the government to help the private sector, labor sector, to induce a good social protection for them?
Okay, Mir Saab, there is already a middle way. In fact, two middle ways prevailing in your economy, I would say. One is called Employees Old Age Benefit Institute, EOBI. Second is called Balochistan Employees Social Security Institution, BESI. Okay. Now, the job of these two institutions is to provide social protection, whether uh, the labor, the employee is in public sector or private sectors. Okay. No, the contributory social insurance schemes they can give you. All the government has to do is to implement their labor laws effectively. You see, if you have five or more than minimum five or more than five employees, you can form a trade union, okay, labor union. So we already have the laws, number one, at the government level. We already have the institutions who would bridge this gap between the labor and the government, the EOBI, the BESI, who could provide this contributory social insurance schemes. So those social insurance schemes, of course, for example, if we talk about EOBI, they deduct per month certain amount from the employer and a little bit fees from the labor, and they would provide the pension to the coal miners, the miners in Balochistan. Okay, so fortunately, for this social security, for this social insurance, the institutions are there. Only even the laws are there, the institutions are there, the laws are there. It's only the job of labor inspector that they should go and enforce that law. No hard money, no millions or billions of rupees involved in this game. Only the effectiveness of the government laws. And it will bridge this gap of the private sector miners, coal miners or others in Balochistan to have a better social protection in their hometown, in their districts and homes. Thank you.
Thank you, Mati, for your this comment. Let me bring our today's discussion towards a conclusion for now. And I'm first of all, I'm a bit disappointed from our government's response because I asked the Secretary Health and the Secretary Social Welfare, and they both were. They wanted to come and join us and give us their point of view because we believe that we always have to listen to the other side of the story before we go to a conclusion. But sadly, I don't know what being the reason we couldn't hear from them or their side of the story. But as they say, that the show must go on, so we have to carry on with our efforts. And if I want to conclude this whole discussion that we had in our last session and in today's session. So the things they melt down to three or four main points that we need to look into them. The first and the foremost issue is that there is a performance issue, and that performance issue is there because we do not have accountability and responsibility mechanism for all the departments that are working either in Balochistan or in Pakistan. So I think that we need to develop mechanism for accountability as well as for responsibility, because I think that we people we don't feel responsible enough for such issues that we should work on them. And if there is no feeling of responsibility, then of course there will be no feeling of accountability as well. And secondly, we see that particularly in the scenario of Balochistan, there is a huge gap of capacity in Balochistan. And one of the reason for this being is that maybe all the departments, they are doing very good jobs, but they are doing it in isolation. So there need to be a synergy all the departments, either they be from the provincial sector or from the federal sector, they need to join in forces, they need to create synergy. And if they think that, all right, they are quite busy, they cannot do such kind of a thing, then we from the private side, as think tanks or as NGOs, we are always there to help the government for better cause. They need to ask us, they need to come to us, or we can go to them if they don't want to come to us. But at least I believe that the government, they need to listen to us. And as Severin was talking in her comments, I have been telling for last, I think, 9 months, I have been telling the government of Balochistan that community engagement is very imperative for success of any intervention. I myself being a scholar of social marketing, and it is our duty to see that how social issues can be brought in more effective way in front of the communities. So for that we need to do community engagement. And sadly our governments, the way that they are doing community engagement right now, uh, if we look into the literature of community engagement, their level, it is not even the medium level of community engagement. High level is far more hard for them to achieve. They are not even on the middle level of community engagement, because we just believe that okay, community engagement means that we should throw out some brochures, and we should just give do 2 or 3 press conferences, or we just make a website and it means that we are engaging the community. So it is not possible. And then, as Dr. Nasir said, that we need to change the way that we are targeting. Because I tell you, even if we are in Balochistan, if you target the people living in the north, and if the same way you target the people living in the south, you will not get the desired result. Because they are culturally different, they are socially different, they are economically different, they are politically different. So we need to change our way of targeting people, and we need to come up with more sustainable ways of targeting people. And once we do all this, we need to make sure that the service delivery issues are addressed by the government. And as in our last discussion, we said that the government of Balochistan, they should have a social protection agency or something which should at least monitor whatever is going on in the province. If they can't do much, at least they can do this much by monitoring the whole situation, and then they can make a plan. So now I would like each of my presenter to just give their concluding remarks just in 1 or 2 minutes, so that then we end this discussion. So we'll start with Severin, and then we'll go on. Yes, please, concluding remarks.
Thank you. I just want to thank you all for the opportunity to speak on this panel. I think it was fabulous. The input is really wonderful. It's a great opportunity. So thank you, thank you, thank you. And my final words are really about, I think governments, especially the government in Pakistan, is at a loss itself as to how to administer this program. And so the only way out of this is to involve communities. The only way out is also to trust communities, but also to have a veto process of who to involve, because not everybody will be trustworthy, and not all social enterprises will be able to meet the demand. So with the limited amount of resources, so selecting partners strategically and doing a veto process to ensure the right people are being, linked with or partnered with is going to be vital in order to make sure that these resources are not wasted. So aside from that, I would say trust the communities. If you can mobilize local communities, I think that you will be very surprised at how much they can achieve for themselves if you give them the means, the training, the resources, and again, those those resources to start a local social enterprise to increase the living standards and I think everything is together. I don't think it's just like give money. I think education and basic needs all have to come together. So it's a multi-pronged problem, and I think we have to look at the problem from a holistic perspective. Coming at it from only one angle is you're gonna see that all the other angles are being neglected and poverty remains. So if the idea is to alleviate poverty, you're gonna have to have a multi-pronged approach. Thank you. Thank you again so much.
Thank you. Okay, Mati, your final comments, please.
Uh, I would only emphasize the need of redefining the social protection in the context of Pakistan. I would like to see social protection as more inclusive and more income generating activity, not only just the cash transfer to the poor and let them be poor. So I would emphasize that, redefine the social protection, take the context of Pakistan, and then let's see what happens and what. And at the end, I would like to say that it's not very difficult job indeed. I'm very optimistic about this. फैज अहमद फैज का एक शेर है कि हर चारा गर को चारा गरी से गुरेज था, वरना हमें जो दुख थे बहुत लादवाना थे. ठीक है जी. Thank you, so nice.
Dr. Nasir sir, please, your final comment.
Thank you so much. My only focus is to look into the Balochistan and try to feel the pain of the Balochistan. If we really want to change in the Balochistan, we have to be a responsive, either at the government level, either at the federal level or the provincial level. Because after 7th NFC award, there is a huge flow of resources to Balochistan. If they fail to develop, it means there is something wrong at the local level. We should have to understand the local need and try to address as soon as possible. Thank you so much.
Thank you. Dr. Alia, your comments, please. Dr. Alia, if she can't hear me. Dr. Safdar. Okay.
No, so I'm here, Mir. I'm here.
Yes, please.
Yeah, I just want to say that, what I infer from everyone's inputs is that things cannot go on the way that they have been. We need to rethink the paradigm of development. We need to rethink the paradigm of the delivery of social services, and we need to rethink the paradigm of providing social protection for the people of Balochistan. And there is enough evidence on the table for this rethinking exercise. And I think in your policy paper, you will have enough avenues to suggest to the government of Balochistan. One more thing I would like to add is that we cannot put development on hold in the time frame that we are sort of rethinking the paradigm of development. One short-term fix would be to link the human development impacts of big development with the big development projects. For example, CPEC. I think it's very important for the government of Balochistan to be cognizant that unless each and every project of CPEC in Balochistan translates into better employment opportunities, into a better quality of life for the workers of Balochistan and their families, they're not going to sort of settle for it. So that kind of awareness and agility and dynamism on the part of the government and civil society to demand human resource outcomes from development outcomes is from development projects is the cry for Balochistan. Thank you.
Thank you, Dr. Alia. Dr. Safdar, your final comments, please.
Yeah, well, thank you very much. First of all, I think we could have discussed even today our strategy in terms of moving on. What I personally believe is that instead of continue talking about the evidence of the plight of people in Balochistan and bring in more data how things are bad in Balochistan. I think we need to move on out of this misery mongering data that we keep on throwing on Balochistan and imagine disruption and talk more about the failure of the programs. Like, let's say, we are focusing on Ehsaas, so we need to produce a quality document on the irrelevance of Ehsaas for Balochistan, for example, irrelevance of the ongoing donor development projects in Balochistan, irrelevance of annual development plan, irrelevance of CPAC. Now, if you take these four big ticket items, we need to produce fresh knowledge on that, saying it loudly and clearly that they are not working, and pushing more money and effort in these broken pipes would not. I mean, how can you produce different results by continue doing the same thing again and again and again? So that I think should be a major takeaway from these 2 days. Uh, we should create evidence on the irrelevance of these four major big ticket items: Ehsaas, donors, ADP, and CPAC, and then come up with a new framework for Balochistan, which then guides the allocation of resources. Uh, so in that context, let's say there is $1 billion funding for socioeconomic development under CPAC. I hinted last time also. I mean, Balochistan government should be able to tell Chinese and EAD that we do not want these projects to be this money to be spent on those public sector expenditure projects which yield very little in case of Balochistan, when we know very well that the public sector expenditure effectiveness in case of Balochistan has gone massively down, not only historically, even horizontally. Something which you can do in one province for 1 rupee, in Balochistan you need four, excluding the distance and other areas. So there, I think we need to have some bold imagination and bring up some new framework where again I'll repeat that it's about social protection when 70-80% of the population is in a dire need of social protection. You do not go for targeting, you go for a higher level of transfer and targeted transfer, and then recreate the local demand. That would make the difference. So there, I think it's now a question of strategizing, of designing the communication,
All right.
and spend time on the social marketing side, which is your core competence actually. Thank you.
Yes, yes. Thank you, thank you. Thank you, everyone. We have run out of time, so we need to end this discussion. But I would like to thank all my expert and all those who attended this session. Thank you very much for all your valuable inputs, and I'll get back to each one of you, inshallah, soon. So all of you, please take care and goodbye. Thank you.